Do you have anxiety and you've been thinking about trying to get help for it? Have you thought about finding a psychologist, but you're either unsure or you're feeling worried about what therapy might involve? Well, stay tuned because in this video, we're going to demystify therapy for anxiety. Welcome back to the Daily Dose. I'm Dr. Lance Garrison. I'm a psychologist who has a background in health psychology and behavioral medicine, and I'm dean for the College of Professional Psychology at the Chicago School. My goal for this channel is to help you better understand how our thinking and our feeling contribute to mental health. Because I believe that knowledge is power, and that when we have that power, it helps us create momentum for positive change in our life. So let's just jump right in. And as you watch today's video, don't forget to hit that like button and subscribe for more content just like this. As I mentioned, we're going to be looking at a particular type of therapy for anxiety called cognitive behavioral therapy. It's also known as CBT. And we'll look at how it can be a really effective tool in helping us manage anxiety. And as always, I want to just take a moment to acknowledge that seeking help for anxiety can be anxiety provoking. It's a challenging step. But if you're struggling with anxiety, I want you to know, number one, you're not alone. Number two, there is hope. CBT is one of the most widely used, researched, and evidence-based therapeutic approaches for treating anxiety disorders, and it's helped countless individuals lead more fulfilling, less anxious lives. And at its core, CBT is based on the idea that our thoughts and our feelings and our behaviors are all kind of interconnected. And when we experience anxiety, we're often having negative or distorted thoughts that lead to intense emotions or anxiety and maladaptive behaviors. And CBT helps you to identify these negative thought patterns and begin to replace them with more balanced and realistic ones. One of the key components of CBT is called cognitive restructuring. And what this involves is learning to recognize and begin to challenge automatic thoughts that really serve as the fuel for anxiety. So for example, if you're prepping for a job interview, you might have thoughts like, oh, I'm going to mess it up again. I'm not good enough. And those thoughts can trigger intense feelings of anxiety. And for some of us, even lead to avoidance behaviors like just canceling the interview altogether. In CBT, what your therapist is going to do is work with you to examine these thoughts objectively. And you'll learn to begin to ask yourself questions like, well, is that thought based on facts or just feelings? Or what evidence do I have that either supports or refutes the thought that I'm having? And by questioning negative thoughts, you can start to develop a much more balanced perspective on them. And in doing so, reduce the power that they have over your emotions. Another essential aspect of CBT is called exposure therapy. And what this involves is gradually confronting situations or objects that trigger your anxiety, but doing so in a safe and controlled way. The goal is to help you build confidence and resilience by learning that, hey, you can handle these situations, and you can do it without being overwhelmed by fear or anxiety. For example, let's say you have a phobia of public speaking. What your therapist might start by having you do is practice giving speeches in front of a mirror, and then gradually work up to speaking in front of a small group of supportive friends or family members, and then stepping forward until you're speaking in front of a group. And by doing that in that step-by-step manner, you can begin to retrain your brain and how it associates these situations with safety and mastery rather than fear and anxiety. Through the CBT process, your therapist is also going to teach you various relaxation and mindfulness techniques. And they help you manage your anxiety symptoms when you're in the moment feeling it. Things like deep breathing exercises or progressive muscle relaxation or even guided imagery. Now, it's super important to remember that CBT is not a quick fix. And it requires active participation and practice on your part. There really are no quick fixes or magic cures. But with dedication and support, CBT can be powerful and a highly effective tool for beginning to kind of reclaim your life from anxiety. So if you're considering CBT for anxiety, I encourage you to reach out to a licensed psychologist in your area or another qualified mental health professional who can help guide you through this process. The American Psychological Association has a list of psychologists nationwide who can help. Remember, seeking help is a sign of strength. It's not weakness. You deserve to live a life free from the constant burden of anxiety. As always, thank you so much for joining me as we've explored a little bit about cognitive behavioral therapy for anxiety today. I hope this video provided you with at least a few valuable insights and a sense of hope. Until next time, be kind to yourself and remember that you have the power to change your thoughts, and in doing so, to transform your life.